Now for the next congenital issue which you'll be looking at in children is the truncus arteriosus. Truncus arteriosus. So for the truncus arteriosus, you could actually see it. There's kind of like they said that one vessel instead of two. Okay, the flow of blood into the pulmonary arteries and the aorta is kind of like mixing up. So oxygenated blood and deoxygenated blood is mixing. You might not actually understand it, but when we discuss it in the lecture, you get to understand it more. So what is truncus arteriosus? It's a rare but it's a serious congenital defect that affects newborns. It occurs when the fetal heart fails to properly separate. So the aorta and the pulmonary artery, okay, they are not separating properly. So this results in what? A single large blood vessel. That's a truncus. Alright. Now this carries blood from the heart to both the lungs and the rest of the body. Of course, So this leads to what? A mixture of deoxygenated blood, that's oxygen poor blood, and oxygenated blood, which is oxygen rich blood. There should be like a clear demarcation here. That demarcation doesn't exist. So everything is just mixing up. Of course. Alright. So normally right ventricle pumps what? Oxygen poor, that's deoxygenated. Left ventricle is oxygen rich. So if you have a mixture of this, a single vessel is mixing everything. So mixed blood is sent to both lung and the body. So you understand? So the body tissues are also getting deoxygenated blood again. The lungs is also getting oxygenated blood again. Alright? So symptoms in children. Because tissues are not getting enough oxygen, the baby is becoming bluish. Alright? They are trying to breathe faster, okay, to compensate. They are weak, failure to thrive, heart murmurs and enlarged liver, sweating during when they are feeding, all right, and they also have a weak pulse. All right. So diagnosis is fetal ultrasound. All right. So they can actually do an ultrasound before, just to dictate it before birth. Echocardiogram. All right. Chest X-rays, ECGs, cardiac catheterization, pulse oximetry. Okay. So you can actually see it. It's at different types. All right. Different types. But mostly you are seeing that there's kind of like a linkage, either down or a whole linkage. You understand? So it's truncus arteriosus. So treatment, surgical repair. So they actually do a surgery to actually close the valve. So pulmonary arteries are separated from the truncus and connected to the right atrium using a conduit. The procedure is often called the Rastelli repair. So ongoing care. So continue following up the child, you understand, to pick up any other complications that might come up.